Hey ladies, welcome to GOC Grace channel. It's time to explore more about your body. In just a few minutes per day, you can take control of your health and well-being. We always advise do not try to take care of your health on your own. Consult with a doctor for advice. Today, we will talk about bacterial vaginosis. Bacterial vaginosis (BV) is a common vaginal infection caused by an imbalance in the natural bacteria found in the vagina. It is the common cause of abnormal vaginal discharge in women of reproductive age. Though not classified as a sexually transmitted infection (STI), it is more prevalent among sexually active women. It results from an imbalance in the normal vaginal flora, specifically a reduction in good bacteria, mainly lactobacillus, that helps to keep the environment slightly acidic, and an overgrowth of the harmful anaerobic bacteria. Hence, the balance shifts, and harmful bacteria outnumber the beneficial ones. Normal vaginal flora versus BV. Normal vaginal flora, dominated by lactobacillus species, which produce lactic acid, maintaining an acidic vaginal pH around 3.8 to 4.5. The acidity inhibits growth of harmful microorganisms and protects the vaginal ecosystem. In bacterial vaginosis, lactobacilli are significantly reduced. Overgrowth of anaerobic bacteria, including Gardnerella vaginalis, Mobiluncus, Prevotella, and Adipobium vagina. Vaginal pH rises above 4.5, which promotes the growth of these harmful bacteria. Causes and risk factors. While the exact cause of BV is not fully understood, certain factors increase the risk of developing it. Sexual activity, particularly with new or multiple partners, douching, which disrupts the natural flora, use of intrauterine devices, iodes, smoking, lack of protective lactobacilli due to individual host factors. Note: bacterial vaginosis is not exclusively sexually transmitted, but is more common in sexually active individuals. Symptoms of bacterial vaginosis. Many women with BV may be asymptomatic, that is, not showing any recognizable symptoms, but when symptoms occur, they often include 1. Thin, grayish-white vaginal discharge. 2. Foul smelling or fishy odor, especially after sexual intercourse. 3. Mild itching or irritation. 4. Burning during urination, less common. Diagnosis. Diagnosis is based on clinical presentation and laboratory tests. The EMSL criteria and Gram stain are the most commonly used diagnostic tools. Complications of untreated BV. Increased susceptibility to HIV and other STIs. Risk of pelvic inflammatory disease (PID). Complications during pregnancy, including preterm birth and low birth weight. Increased risk of post-surgical infections, for example after abortion, hysterectomy. Treatment options. Antibiotic therapy. Metronidazole oral or vaginal gel. First-line treatment. Clindamycin oral or vaginal cream. Alternative option. Treatment for partners. Routine treatment of male partners is not recommended. In recurrent BV cases, partner treatment may be considered. Avoidance of triggers. Avoid douching and unnecessary use of feminine hygiene products. Recurrence and prevention. Recurrence is common, with about 30% of women experiencing BV again within 3 months. Prevention strategies include avoiding vaginal douching, using condoms consistently, reducing the number of sexual partners. Probiotics. Lactobacillus containing supplements or suppositories are being studied, but evidence is still evolving. BV versus other vaginal infections. 1. BV has thin, white gray discharge. 2. Candidiasis has thick, white cottage cheese discharge. 3. Trichomoniasis has frothy, yellow-green discharge. Conclusion: bacterial vaginosis is a common, but often misunderstood vaginal condition. While typically not serious, its symptoms can affect quality of life, and complications may arise if left untreated. prompt diagnosis and appropriate treatment can effectively manage symptoms and reduce the risk of recurrence. Ongoing research aims to better understand the microbiome's role in bacterial vaginosis and develop improved prevention strategies. Do not forget that it's okay to ask for help and support when you're struggling with any health condition. If you need additional information, don't hesitate to ask. See you on our next post.